Hello, this is Neil Baum from New Orleans, Louisiana, and I would like to talk with you about the medicinal value of humor. In the past, I know most of the topics I have chosen for these grand rounds in urology videos have been a little on the dry or humorless side. So I'd like to change it up a little bit and talk to you about the value of humor. It's been an enigma to me that the urology profession has a burnout rate in excess of 50%. And yet, every urologist I know seems to have a good sense of humor, is always ready for a quip or a quote or a joke. And I'm just amazed that our burnout rate is so high when so many of us enjoy our profession and enjoy the levity and humor that it brings. So in this video, I'm going to discuss a brief history of humor and discuss the relationship between humor and illness, and then demonstrate the scientific basis behind humor and the use of humor in the era of this pandemic. Humor is thousands of years, humor and wellness is thousands of years old. The Old Testament stated that a merry heart doeth good like a medicine. Even Jesus, I believe, had a sense of humor when he said, it is easier for a camel to get through the eye of a needle than for a rich man to enter the kingdom of God. In the 14th century, a French surgeon encouraged family and friends to engage in jokes and levity with patients to help cheer them up. If you type in humor in medicine in Google, you'll get about 83 million results. And this is amazing to me that there are so many examples of humor in medicine. An article from the Baylor University College of Medicine Proceedings wrote an excellent article about the relationship between laughter and healing. And who can ever forget Patch Adams, who decided that he was going to leave the comfort zone and decided to put a little levity and humor when he engaged with patients. So what's the physiologic explanation or basis of humor and healing? Humor leads to increased respiration and increased oxygenation. It increases the heart rate. It increases the release of endorphins. It stimulates the immune system by decreasing the cortisol level. And humor also decreases anxiety. And perhaps humor can be helpful in decreasing the epidemic rate of burnout amongst urologists. Humor and the immune system demonstrates an increase in salivary IgA, which increases immunity for colds and upper respiratory tract infection and enhances the T cells. Humor is associated with decreasing stress by decreasing the cortisol level. As a result, humor can be beneficial for anxiety and stress. Humor has a definite positive relationship with depression. A study of 80 patients exposed to humor for 4 to 6 weeks showed that there was success in either decreasing the antidepressant medication or the discontinuation of the medication. One of the best books I ever read as a medical student was by Norman Cousins, entitled The Anatomy of an Illness as Perceived by the Patient. Norman Cousins was the editor of the Saturday Review, and he had incapacitating ankylosing spondylitis. And he said just 10 minutes of laughter often provided him with 2 hours of pain relief. So you can see that humor increases the release of endorphins, which is the most potent of pain hormones. It increases the pain threshold in a group of patients when compared to a control situation. And it's even used with children to decrease their pain after watching funny videos. I can tell you that on so many occasions when I just put on a red nose and tried to examine a toddler, that the red nose was just the right amount of distraction that made the examination possible. Humor has a relationship to hypertension. Initially, humor increases the blood pressure, but there is a sustained decrease in the blood pressure after watching humorous videos. Humor is also useful in this area of the pandemic. No question that COVID-19 has increased the stress level of both patients and physicians. And humor is known to decrease the cortisol level and as a result enhances the immune system. There are so many jokes associated with the pandemic, and I have just picked 3 that I'll allow you to read at a later time that demonstrate that there really is a role, even in this pandemic era, of the use of humor. It's been shown that even a smile has the effect of increasing endorphins and helps us to cope with the pandemic. So how do you use humor in your practice? Well, years ago, I used to have joke magazines and funny videos shown of the Marx Brothers or Three Stooges in my reception area. My most favorite magazine of all times is Mad Magazine. And I think you can tell my age if I tell you how fascinated I was with Mad Magazine. And I had old copies in my reception area and in the exam room. There are also a large number of joke websites. One of the best ones I have looked at recently is shown with this URL that you can copy and paste into your browser of the 20 funniest websites for humor on the web. The other thing that I have done in my practice is I share humorous fact sheets. I think a fact sheet contains more than name, address, phone number, and website. I think fact sheets that bring out a little levity for the receptionist might be just what the doctor ordered. So, bottom line, take home message. As Bertrand Russell said, laughter is the most inexpensive and most effective wonder drug. There are no side effects to humor. There are no allergic reactions. There is never any evidence of a HIPAA violation. I suggest that we consider writing a prescription for humor for our patients, but also we take a dose of humor for ourselves. We are in the healthcare profession, and as a result, we are dealing with life and death situations on a daily basis. So it's important that we take our work seriously, but not necessarily ourselves. I genuinely believe there is a role for humor in modern day medicine. So if you have any comments, or if you'd like to send me a joke, or if you'd like a copy of my paper, the medicinal value of humor, you can reach me on the website shown in the last slide. Well, I hope you found a little joy and enjoyment from watching this video on the medicinal value of humor. Thank you.